Hello, dear students. This is Professor Janula. Today, I am going to explain the physiological changes that occur during pregnancy. Pregnancy is the time when a baby grows inside a woman's uterus. It usually lasts about 40 weeks, which is a little over 9 months. The length of pregnancy is counted from the first day of the woman's last menstrual period until the baby is born. Duration of pregnancy. A normal pregnancy lasts about 40 weeks. It is divided into 3 trimesters. The first trimester spans from 0 to 12 weeks. The second trimester spans from 13 to 28 weeks. The third trimester spans from 29 to 40 weeks. Physiological changes during pregnancy. During pregnancy, the body goes through gradual changes in structure, function, and chemicals. These changes affect not only the reproductive organs, but also all other body systems. Now let's look at the changes in the genital organs during pregnancy. Starting with the vulva, it becomes swollen and more vascular, meaning it has an increased blood flow. The vagina also undergoes similar changes. It becomes thicker, swollen, and more vascular. This increased blood supply causes a bluish color of the vaginal mucosa, which is known as Jacquemin's sign. These changes are normal and help prepare the reproductive organs for childbirth. Next, let's talk about the uterus during pregnancy. The uterus undergoes enormous growth to accommodate the developing fetus. Its weight increases dramatically, from about 60 grams before pregnancy to 900 to 1,000 grams at term. Similarly, the length of the uterus grows from around 7.5 centimeters to about 35 centimeters by the end of pregnancy. These changes are essential to provide space and support for the growing baby. Continuing with the uterine changes during pregnancy, the width of the uterus increases from about 4 centimeters to 24 centimeters. The weight of the uterus rises significantly from 50 grams to around 1,000 grams. Early in pregnancy, the uterine wall thickens from about 1 centimeter to 2 centimeters. But by the end of pregnancy, it thins to around 0.5 centimeters to accommodate the growing baby. The volume of the uterus also increases dramatically, from about 2 milliliters to more than 1,000 milliliters. These changes allow the uterus to expand and support the developing fetus throughout pregnancy. Let's discuss the growth of the uterus during pregnancy. By the end of the 12th week, the uterus can be palpated just above the symphysis pubis. Around the 20th to 22nd week, it reaches the level of the umbilicus. By the 36th week, the uterus is so large that it touches the xiphoid process, which can sometimes make breathing a little difficult. About 2 weeks before term, in a prima gravida, a woman experiencing her first pregnancy, the fetal head settles into the pelvis. As a result, the uterus drops slightly, returning to the height it was at 36 weeks. This dropping of the uterus is called lightening. The image shows the fundal height, which is the distance from the pubic bone to the top of the uterus, measured in centimeters. Fundal height correlates with gestational age in weeks. For example, 12 weeks just above the symphysis pubis, 20 weeks at the level of the umbilicus, 36 weeks near the xiphoid process. Monitoring fundal height helps assess fetal growth and uterine development during pregnancy. Lightening refers to the dropping of the fetal head into the mother's pelvis near the end of pregnancy. It occurs about 2 weeks before labor in a first pregnancy, prima gravida. The uterus descends slightly, reducing pressure on the diaphragm. This can make breathing easier, but may increase pelvic pressure and cause more frequent urination. It signals that the body is preparing for labor. Now let's talk about the changes in the body of the uterus. The muscles of the uterus undergo two main changes: hypertrophy and hyperplasia. Hypertrophy means the existing muscle fibers get bigger. They increase in length and width. Means there is a small increase in the number of muscle fibers. After 20 weeks of pregnancy, the muscle fibers stretch even more as the uterus expands to accommodate the growing baby. These changes allow the uterus to grow large enough to support the fetus while still being strong enough for labor. Let's look at some other changes in the uterus during pregnancy. Blood flow to the uterus increases because hormones like estradiol and progesterone cause the blood vessels to dilate. The fundus, top part of the uterus, enlarges more than the body. The shape of the uterus changes as pregnancy progresses. In the early months, it is pyriform, pear-shaped. By 12 weeks, it becomes more globular. At 28 weeks, it is ovoid, egg-shaped. After 36 weeks, it becomes merely spherical as it reaches full size. These changes help the uterus accommodate the growing fetus efficiently. Now let's talk about the position and some functional changes of the uterus during pregnancy. The uterus is normally anteverted, tilted forward, up to about 8 weeks of pregnancy. As it enlarges, it rests on the urinary bladder, which can cause frequent urination. Braxton Hicks contractions are another change. These are irregular, infrequent, spasmodic, and painless contractions. They do not cause dilation of the cervix and are sometimes called practice contractions, preparing the uterus for labor. An anteverted uterus is when the uterus tilts forward, resting over the bladder. This is the normal position of the uterus in most women. In early pregnancy, the uterus remains anteverted up to around 8 weeks. As the uterus enlarges, it can press on the bladder, which may lead to frequent urination. Let's discuss the changes in the isthmus of the uterus during pregnancy. During the first trimester, the isthmus hypertrophies and elongates, growing to about 3 times its original length and becomes softer. After 12 weeks, the circularly arranged muscle fibers in the isthmus help to hold the fetus securely within the uterus. These changes are important for supporting the growing baby while preparing the uterus for labor. Now let's look at the changes in the cervix. The cervix undergoes hypertrophy and hyperplasia, meaning it enlarges and increases the number of cells. Vascularity increases, which makes the cervix softer. This is known as Goodell's sign. Cervical secretions contain IgA and IgG antibodies, which help protect the pregnancy from infections. To give you a visual idea, the non-pregnant cervix feels like the tip of the nose, whereas a pregnant cervix feels softer, like an earlobe. These changes are important for supporting the fetus and protecting against infections. Let's discuss the changes in the fallopian tubes and ovaries. Fallopian tubes. The uterus grows and rises. The uterine end of the tube becomes almost vertical beside the uterus. The total length of the tube increases slightly. The tube becomes congested due to increased blood flow. Ovaries. The appearance of the ovary changes. It looks bright orange initially, then yellow, and finally pale as pregnancy progresses. Both the ovarian and uterine cycles are suspended, meaning no ovulation occurs during pregnancy. These changes help support and maintain the pregnancy. Hope you have understood till now. We will continue in the next video. Thank you.